Hello and welcome to video 9 for Unit 5, Mental and Physical Health. This video will be looking at psychological therapies. By the end of this video, you should be able to answer the following questions. What are the characteristics of psychological therapies, including psychodynamic, cognitive, applied behavior analysis, cognitive behavioral, and humanistic therapies? How is group therapy different from individual therapy? And what are the effective uses of hypnosis? To start out, we are going to look at the psychodynamic therapy. This therapy is rooted in the Freudian psychoanalytic theory, and it aims to explore unconscious processes and how they influence current behavior. This therapy emphasizes the role of early childhood experiences and internal conflicts in shaping individuals' psychological states. The goal is to bring unconscious thoughts and feelings to conscious awareness, allowing the individual to gain insight and resolve these conflicts. This type of therapy uses free association, which encourages patients to speak freely about whatever comes to mind, without censorship or filtering. This technique aims to uncover hidden thoughts, feelings, and memories that may be influencing current behavior and emotional states. In addition, psychodynamic theory uses dream interpretation, where they analyze the content of dreams to uncover unconscious desires, fears, and conflicts. Dreams are seen as a window into the unconscious mind, revealing hidden aspects of the psyche. So you can see with these techniques, the psychodynamic therapy really aims to look at the unconscious mind and desires of the patient. Next is the humanistic therapies. In psychology, this emphasizes the inherent goodness of people and their natural drive towards self-actualization. This approach focuses on the individual's subjective experience and the belief that people possess free will and the potential for personal growth. Humanistic therapy aims to help individuals understand themselves better and reach their full potential. A therapist using the humanistic perspective might help a client struggling with low self-esteem by exploring their feelings about themselves and their life experiences. Through open dialogue, the therapist supports the client in recognizing their intrinsic worth and capabilities, encouraging personal growth and self-fulfillment. In humanistic therapy, one of the main pillars is active listening, and this is a communication technique used in therapy to ensure that the therapist fully understands the client's message. It involves the therapist paying close attention to the client's words, reflecting back what they hear, and providing feedback that shows understanding and empathy. Active listening creates a supportive and validating environment for the client. In a therapy session, a client might express feelings of frustration about their job. Their therapist, practicing active listening, might say in response, "It sounds like you're feeling really overwhelmed with your current workload and unappreciated by your supervisor. Can you tell me more about this?" This response validates the client's feelings and encourages further discussion. Another key concept of the humanistic therapy is this idea of unconditional positive regard. This is a fundamental concept in humanistic therapy, particularly in the client-centered approach developed by Carl Rogers. This involves the therapist accepting and valuing the client without judgment or conditions. This acceptance helps clients feel safe to express themselves freely and fosters a sense of self-worth. A client might reveal feelings of guilt and shame over a past mistake. A therapist showing unconditional positive regard would respond with empathy and acceptance, such as saying, "It's okay to feel that way. Everyone makes mistakes and it doesn't define who you are as a person." This response helps the client feel accepted and supported, reducing the feelings of shame and fostering self-compassion. Next is applied behavior analysis, or ABA. This is a therapeutic approach based on the principles of behaviorism, and it focuses on improving specific behaviors such as social skills, communication, reading, and adaptive learning skills through the application of behavioral principles. ABA is particularly effective in treating individuals with autism spectrum disorder. ABA is commonly used to teach children with autism functional communication skills. A therapist might use positive reinforcement to encourage a child to use words to express needs instead of engaging in tantrums. Using the principles of behaviorism, conditioning is used, and this involves learning associations between stimuli and responses. There are two primary types of conditioning used in therapy. classical, and operant, which we've learned about already. In addition, behaviorists might use exposure therapies, and these are a set of techniques designed to help individuals confront and reduce their fear and anxiety by gradually exposing them to the feared object or situation in a controlled manner. A person with a fear of heights might start by looking at pictures of tall buildings, then progress to standing on a low balcony, and eventually work up to higher elevations, all while practicing relaxation techniques. This small, little by little process is called systematic desensitization. We take baby steps toward our full major goal. Another type of therapy in the behaviorist approach is aversion therapy. This is where we pair an unwanted behavior with an unpleasant stimulus to reduce the behavior. It's based on classical conditioning principles where the goal is to create a negative association with the behavior. For example, in treating alcoholism, a drug that causes nausea when combined with alcohol may be used. The unpleasant physical reaction helps create a negative association with drinking, reducing the likelihood of the behavior. Token economies are also used, and these are a type of operant conditioning used in therapeutic settings, particularly in institutions or schools. This is where an individual can earn tokens for engaging in desired behaviors. These tokens can later be exchanged for rewards or privileges. In a classroom setting, students might earn tokens, tickets, or passes for completing assignments, participating in class, or exhibiting good behavior. These tokens can then be exchanged for extra recess time, snacks, or other rewards. Another form of applied behavior analysis is biofeedback, and this is a technique teaches individuals to control physiological processes such as heart rate, muscle tension, and brainwave activity by providing real-time feedback. The goal is to gain voluntary control over these processes to improve physical and mental health. A person who has chronic migraines might use biofeedback to learn how to relax specific muscle groups or regulate breathing patterns to reduce the frequency and severity of migraines. Next, let's talk about cognitive therapies. This is a form of psychotherapy developed by Aaron Beck, which we've talked about before. Aaron Beck focuses on identifying and changing distorted or unhelpful thinking patterns, beliefs, and attitudes that contribute to emotional distress and maladaptive behaviors. The premise is that dysfunctional thinking leads to negative emotions and behaviors, and by altering these thoughts, individuals can achieve more positive outcomes. A person suffering from depression might believe they are worthless. Through cognitive therapy, they learn to identify this automatic negative thought, evaluate the evidence for and against it, and then replace it with a more balanced view of themselves. In this case, maladaptive thinking refers to patterns of thoughts that are counterproductive and interfere with daily functioning. These thoughts are often distorted, negative, and self-defeating, leading to emotional distress and unhealthy behaviors. A person with social anxiety may engage in an all-or-nothing thinking, believing that they must be perfect in social interactions or they will be rejected. Recognizing and challenging this maladaptive thought can help them develop more flexible and realistic expectations. Part of this process is called cognitive restructuring, and this is a core component of cognitive therapy, and it involves techniques that help individuals identify, challenge, and modify distorted thoughts. The process includes recognizing cognitive distortions, evaluating the validity of these thoughts, and developing more realistic and adaptive ways of thinking. Someone with anxiety, for example, may catastrophize by thinking, if I fail this test, my life is over. Cognitive restructuring would help them challenge this thought by examining the evidence, considering alternative outcomes, and developing a more balanced perspective. Cognitive therapists might also use fear hierarchies, sometimes called anxiety hierarchies, and these are used in exposure therapy to treat anxiety disorders, including phobias and PTSD. A fear hierarchy is a graded list of anxiety-provoking situations or stimuli, arranged from least to most frightening. Clients gradually confront these situations in a controlled manner. A person with a fear of public speaking, for example, might start by imagining giving a speech, then progress to speaking in front of a small group, and eventually speak before a large audience. Each step helps them build confidence and reduce anxiety. So fear hierarchies are going to be used in conjunction with systematic desensitization. Finally, cognitive therapies are going to address the cognitive triad. The cognitive triad is a concept in cognitive therapy that describes 3 types of negative thoughts that are common in depression. We've talked about this in our last video. Negative views about ourselves, the world, and the future. These negative thought patterns reinforce each other, creating a cycle of depressive thinking. A depressed individual might think, I am worthless, and this is a negative view of themselves. People are cruel, a negative view of the world, and things will never get better, a negative view of the future. Cognitive therapy aims to help them challenge and reframe these thoughts to see themselves and their life more positively. Next, let's talk about the combination of cognitive and behavioral therapy, cognitive behavioral therapy, or CBT. This is widely used evidence-based therapeutic approach that aims to change maladaptive thinking patterns and behaviors. CBT operates on the premise that cognitive distortions contribute to emotional distress and behavioral problems. By addressing these cognitive distortions and teaching coping skills, CBT helps individuals develop healthier thought patterns and behaviors. A person with social anxiety, for example, might use CBT techniques to challenge and change irrational beliefs about social interactions, gradually exposing themselves to social situations to reduce fear and build confidence. Dialectical behavioral therapy, or DBT, is a type of cognitive behavioral therapy specifically designed for individuals with borderline personality disorder and other conditions involving emotional dysregulation. DBT combines cognitive behavioral techniques with mindfulness practices and principles of acceptance and change. Some of the techniques include mindfulness, which is developing awareness and acceptance of the present moment without judgment, helping individuals stay grounded and reduce impulsive reactions. Another technique is distress tolerance, and this is building skills to tolerate and survive crises without resorting to self-destructive behaviors, including techniques such as distraction, self-soothing, and radical acceptance. Another is emotional regulation. This is identifying and managing intense emotion, reducing emotional vulnerability, and increasing positive emotional experiences. And finally, interpersonal effectiveness. This is enhancing communication and relationship skills, including assertiveness, setting boundaries, and maintaining healthy relationships. Another form of cognitive behavioral therapy is rational emotive behavior therapy, or REBT. This is a form of cognitive behavioral therapy developed by Albert Ellis. It focuses on identifying and changing irrational beliefs that lead to emotional and behavioral issues. REBT emphasizes the role of rational thinking in emotional well-being. REBT is probably the most controversial of all of the cognitive behavioral therapies because it's often very confrontational. Some of these techniques include identifying irrational beliefs. So the person is recognizing and challenging irrational beliefs that cause emotional distress, such as, I must be perfect, or everyone must like me. Next, we have to dispute those irrational beliefs. We have to actively question and dispute irrational beliefs to develop more rational and realistic thoughts. Next, you have to develop rational alternatives, which is formulating and adopting healthier beliefs that lead to positive emotions and behavior. And finally, there's behavioral interventions, which is where we engage in activities that reinforce rational beliefs and promote adaptive behaviors. Now let's talk about the difference between group and individual therapy. Group therapy involves a small group of individuals who meet regularly with one or more therapists to discuss their issues, share experiences, and support each other. It's designed to address a range of psychological and emotional challenges, leveraging the dynamics of group interactions to facilitate healing and personal growth. Having a group with you who's gone through similar experiences helps the person feel less alone. Some key features of group therapy include therapeutic interactions. So, for example, participants benefit from hearing others' perspectives and experiences, which can offer new insights and coping strategies. The group setting also provides opportunities for feedback and support from peers. Group therapy also helps build social skills. It helps them practice and improve social skills such as communication and empathy in a controlled environment. The group also provides a sense of belonging and validation as individuals realize they are not alone in their struggles. And finally, group therapy can be more cost-effective compared to individual therapy because the therapist's time and resources are shared among multiple clients. This doesn't mean group therapy is best for everyone, but it is an option for people who are going through some psychological struggles and they need some support. Finally, let's talk about hypnosis. Hypnosis is a psychological state characterized by heightened suggestibility, focused attention, and deep relaxation. During hypnosis, individuals are guided into a trance-like state by a trained practitioner, often through verbal suggestions and relaxation techniques. In this altered state of consciousness, individuals may experience increased receptivity to suggestions and a heightened capacity for concentration. Hypnosis has been shown to be effective in managing and reducing various types of pain, including acute, chronic, and procedural pain. The effectiveness of hypnosis in pain management is attributed to several mechanisms. First, distraction. Hypnosis can divert attention away from pain by focusing the individual on relaxing or comforting imagery. The distraction can reduce the perception of pain intensity. The next mechanism is altered sensory processing. Hypnosis can modify the way pain is processed in the brain, leading to changes in sensory and emotional aspects of pain. This may involve reducing the distress associated with pain or altering the perception of its intensity. Next is enhanced relaxation. The deep relaxation achieved during hypnosis can lower physiological stress responses and muscle tension, contributing to pain relief. Hypnosis is also utilized in treating anxiety disorders by addressing the underlying cognitive and emotional process that contribute to anxiety. The effectiveness of hypnosis and anxiety treatment is linked to several factors. First, relaxation and stress reduction. Hypnosis promotes deep relaxation and reduces physiological arousal associated with anxiety. This relaxation response can lower anxiety levels and improve emotional regulation. Next is cognitive restructuring. Through hypnotic suggestions, individuals can reframe and challenge negative thought patterns and beliefs that contribute to anxiety. This cognitive restructuring can lead to a reduction in anxiety symptoms. Next is exposure therapy. Hypnosis can be used to facilitate controlled exposure to anxiety-provoking situations or thoughts in a safe and supportive environment. This process can help individuals gradually desensitize to anxiety triggers. So hypnosis is a therapeutic tool that can be effective in managing pain and treating anxiety by leveraging altered states of consciousness to modify perception, enhance relaxation, and address cognitive and emotional factors. Its effectiveness varies among individuals, and it is often used in conjunction with other therapeutic modalities to achieve optimal outcomes. While research supports the utility of hypnosis in these areas, research does not support the use of hypnosis to retrieve accurate memories or regress in age.